So on that note, I think I am going to, just so that we are on time and I have a reputation for speaking too much, I'm going to go ahead and invite my wonderful colleague, Dr. Hua Zhou, who in biostatistics department we call Big Data Zhou, by the way. And Hua is going to talk about the challenges of big data and all the wonderful things that he's been doing to tackle it. So here you go, Hua.
First, thank you for the introduction, Sudipto. I have to say I'm always a little bit not comfortable with this nickname, big data. All my colleagues are working, in our department are working on big data. And from today's event, so many colleagues outside of the department are working on big data. So you have to give me more specific, tailored to me nickname, maybe.
I'll start working on that.
Okay, yeah. First, I will give a very brief overview of the research I am doing. So myself has a long-term interest of developing statistical learning method and algorithm for high-dimensional data. Usually, they arise from genomics and neuroimaging and electronic health records. In recent years, I got interested in something called biobanks. So on the right panel are a few data sources, biobanks we are working on. First, the sample size is ridiculous, 500,000, 1 million, or a couple millions. And besides that, for each of the individual, they have all this data available, genomics, electronic health record, and a subset of the samples even have a different modality of neuroimaging. So often I'm just joking with my students, you're not working on big data, you are working on big data squared or big data cubed, So that's the kind of data myself have been interested in recent years. And of course, you can imagine there are all kinds of issues in the biobank data. There's a data quality issue, statistical modeling challenge, and especially also computational challenges. But in the last couple of years, we managed to do something due to the hard work of students, postdocs, and our wonderful collaborators. Here's just a snapshot of a few papers we published last year. And we can see out of biobank, we not only can contribute to basic science like genetics and genomics, but also lots of results have a translational value. For example, precision medicine, diabetes care, and smart health, how they can improve patient care. Actually, the last work, Jing Zhou, my colleague Jing Zhou led the last project, which they find a surprising link between the oral diabetes medication and dementia, which caught lots of media attention. So if you want to know more, ask Jing. So that's a kind of research we have been doing. So and recently, our team is selected as one of the 8 teams nationally for a pilot project jointly sponsored by VA and Department of Energy. And the idea is, VA has a MVP biobank and also a tremendous amount of patient care data. And the data is just sitting there, but it's so hard to analyze them. At the same time, all those national labs have wonderful computing facilities. So the idea is, can these two departments collaborate with each other, use the computing resource at DOE to develop some large-scale AI or machine learning methods to improve patient care. And we are very fortunate to be selected as one of the teams for this pilot project. And I have to mention our team is very, very interdisciplinary. So we have my wonderful colleagues, Jing Zhou and Gang Li in biostatistics, also clinician Peter Riven at VA, and a top computational scientist, Ben McMahon at Los Alamos National Lab. So we are very excited about this coming project. So that's pretty much I want to say about my own research. I do also want to spend a few minutes to discuss some data science related educational activities going on in biostatistics. First, of course, our department are very proud to produce next generational data scientists who can meet the big data challenge in biomedical research or public health. Just a couple of weeks ago, in our faculty meeting, we are discussing student awards. And I feel kind of it's a little bit scary to see how well our students are doing. So they are not only doing very hard technical mathematical modeling, but also they are doing very high impact research. Here are just two examples. Joe Zoller is working on aging and COVID-19 research, and Erica is working on eye disease. And I said it's a little bit scary because, I mean, you go to Google Scholar, they already have like 20 papers and hundreds of citations. I almost feel lucky I already got a job. If I'm fresh, if I'm a fresh biostat PhD, I'm not going to compete with these guys. So that's, of course, our one major goal as a department to educate, to train next generation data scientists. But also, I want to mention our department has spent lots of efforts to create the data science education, not only for biostatisticians, but also for students in our school. I often get students outside of my department ask me two questions. One is, data science is so important, I want to learn it, but computer science courses, it's so hard to enroll and so on. I usually say, you know what, maybe you don't need to look far. Biostat has created a few courses which is going to be a very welcoming environment for non-biostatisticians. For example, there's one course, Biostat 203B, which is Introduction of Data Science, which covers lots of generic data science material. And then students say, oh, that's wonderful, but you know, biostat courses is famous for so technical, so mathematical, so challenging. We just don't want to take it. And then for the second question, I will show the data. For example, last quarter, I taught this class, and here I'm just showing the proportion of students who got A+ in my class. Stratified by major, there were like 4 and 5 students from AP and HPM. All of them get A+, and also a couple of bioinformatics students, they got A+, much higher than biostat students. And it's not, no, I didn't do this purposely. I mean, it kind of makes sense because data science, of course, there are so much analytical stuff, but also there's size component, right? And students from other departments usually provide very broad perspectives, you know, how to make story out of data, how to make scientific discoveries. So really, data science is for everyone. So of course, also we go beyond the school. If you pay attention to the school screen, you may see this summer training program. I'm so fortunate to be part of the team led by Mei Wang and Mike Perlip. In this summer training program, we are recruiting students from 3 worlds: community health science, data science, and system science. And we are excited to start working with the first cohort this summer. I know my time is running out, but I have to mention this. So if still you feel there's not enough data science going on in the school, now we have a new degree program, and this is a professional degree program just approved last week by the UC system. And I want to thank all of you for the support, and we are trying to kick off this fall. And we also have some outreach, lots of outreach activities. This is just a picture. Our group works with high school students in the summer. And I do acknowledge generous funding by the federal agencies. Thank you so much. Yeah.